Assalamualaikum dan salam sejahtera bersama saya Qistina Donna Lee Abdullah di dalam rancangan Bual R&D TVS. Bersama kita pada hari ini adalah Profesor Dr. Patrick Then. Beliau merupakan ketua di School of ICT dan as the Director of Center for Futures Digital in Swinburne University. Today we are going to talk about the digital health. So what in your research, what is the definition of this digital health?
Yeah, when I started digital health research back to like 2008, there was no term called digital health at that moment, where a lot of us are still struggling with dial-up internet connectivity.
Correct,
And at that time, health informatics is more of a common terms. So today, when we look at internet around us, the smartphones among us, this is where digital health become prevalent and common, where healthcare can be delivered digitally. This is my layman definition of digital health.
So no need for us to go to the hospital or to
Yes.
clinic. It is all
Yes.
on the smartphone. It is very convenient nowadays.
Yeah,
Yeah.
yes.
So even nowadays, the smartphone is cheaper than when we can also easily get it. The kids also are doing gaming on the apps as well, right?
That's right.
Yeah.
Yeah, there is not much learning curve for every single user to use phone,
Correct.
smartphone,
Yeah.
which means digital health for them is also not a difficult things to do or to use. So today it become more and more common, especially during this COVID-19 era.
Alright,
A lot of people don't want to simply go to hospital to take medicine or see their doctor just to measure blood pressure, which is
So
not
probably
viable.
will be challenges, right? Because the kids, probably the new generation will easily can use the apps, but will be more challenges for the elderly, I would say, the older generation. What do you think about that? Can they easily learn the apps?
Surprisingly, before COVID-19, we really see resistance amongst elderly users to use apps on their phone. But during COVID era until now, they seems like adapting very well. This is quite a surprise, which I think there's a will, there's a demand, there's a will. I think.
Exactly. So they are also learning how to use it. Even the kids also can teach the elders people, the parents to use it, right?
Yes,
So
yes.
on the apps, especially on
Yes.
the apps. So for these people, because we are now restrict from going out from the house, so probably this will help the elders as well to learn on how to use the apps and basically to apply the digital, how we call that, the information on the apps itself, right?
Yeah, another angle to look at this is from the healthcare provider, like hospital clinics. They have big downturn in terms of number of patients during
Oh,
COVID
really?
era. So now they are motivated to reach out to their customers or patients living in their house without moving or going to clinics or hospital.
Exactly.
So it's a demand coming from both sides, provider and the consumer.
So they will have to promote more on their products on the apps as
Yeah,
well. Yeah.
like teleconsultation. A doctor can consult a patient remotely now.
Right. Thank you to Prof Then for the information just now. We are going for a short commercial now. Okay, we'll continue after this. Kita kembali lagi bersama saya di dalam rancangan Bual R&D TVS. Bersama saya hari ini adalah Prof Patrick Then daripada Swinburne University. Okay, we're talking about just now is the, what we call that, the application of digital health. Yeah. So probably for yourself, why do you feel so motivated, interested into this particular area?
I think health is something relevant to everybody, including myself, and of course our family members. If I were to choose any research to do, I would, why not I choose some kind of research area that benefit myself and my family member and my friends directly.
Definitely.
All of us are growing older.
Of course, everybody.
So the day before we are born, we already need healthcare services. all the way until the end of our days.
Correct.
So I think the demand is always there.
Exactly.
Then why not we embark into this digital health?
So you have embarked into this research. It's not because of the pandemic COVID-19, right? It's way before that,
way
isn't it?
before, like in 2008.
I see.
About 12 years ago.
Right.
Yeah.
That time we're struggling using the the apps and the computer by that time, right?
Yeah,
so you have already
yes.
doing this type of digital health in the app. So that will be very good. Even now, because of the pandemic COVID-19, I would say you will have to survey more and do more research on that, isn't it?
Yeah. In fact, because of pandemic, the demands for digital health suddenly strive.
Tremendously
growth.
Exactly.
Suddenly, a lot of people are aware of the importance of using or utilizing digital health in their daily life. When I say a lot of people, means including normal people, patients, and also doctors, nurses, healthcare practitioners, including lawmaker. They are also start to accept.
So by doing this, coming out with a new development in the technology and innovation, you will need a lot of grants. I understand that you have internal or external grants. So what are the grants that you have now for your current projects?
Current projects are funded by the Ministry of Higher Education. One of them is Smart Chronic Disease Management System, where in layman term is any user can use an app to tag the picture of the food they take every day, and the apps will automatically recognize the food and calculate the calories, nutrition, and so on, including oil, fats.
Very dangerous.
Yes. So
Fats
this
can be very dangerous.
based on this, they can calculate the risk of the users getting non-communicable disease such as diabetes, high blood pressure.
So this is from the internal grants, or I would say the government grant. External grant.
Government grant.
Yeah. What about the from the overseas, maybe from the US or from the other countries? Do you have grants?
I have grants from Singapore, but this grant is more funding towards oil and gas 4.0.
I see.
It's not really digital health.
Right.
So this is.
So with this, the research that you have with all your RAs and also your group, what is the impact to the economy or the social economy of Malaysia, especially in Sarawak?
For sure, the first impact will be the human resource development, where our research assistant, our students who have gone through the program, master or PhD or even undergraduates, they possess the skills and knowledge in digital health area, where this is actually a transdisciplinary and also multidisciplinary area, where the student can always demonstrate and practice or apply their skills in their working environment, which is very good for employer because students possess multiple facets of skills that is very timely and useful for current business environment that is so dynamic, especially now we are in COVID and going to post-COVID, or maybe there is no post-COVID, it's always ever-changing. So students need to be very adaptive and dynamic and know how to evolve, how to innovate in their career like 40, 50 years. So I think this is the first impact. Second impact, of course, is the economic impact where the states or the country can benefit from higher GDP because knowledge worker like this, they are not only generating work hours, but they are generating intellectual property that can bring in more income in terms of license or royalty to the country.
I see. With this, doing all this R&D and research development, what is your highest achievement so far?
Highest achievement, I think, is something difficult for me to judge. I would say the team efforts is the real achievements that are being attained throughout all these different research projects in digital health. If we were to take a snapshot of so-called achievement, there were maybe some event I can think of, like we won best paper awards in conferences.
Okay.
We also being invited to present our work in the inaugural digital
Conferences.
summit
Okay.
by European Cardiology Society (EAC) in Estonia.
That is in overseas.
Yeah, in
Okay.
Estonia, and also in Taiwan and Singapore. So this is kind of a achievement a little bit, like myself, because of all this research. I have been awarded some like a leadership excellence award by US-based professional society, Society for Design and Process Science.
Wow.
So this a bit of pieces here and there,
Okay,
but if we put it all together, I would say the team really achieved. Everybody in the team achieved
Teamwork.
their own forte, their own so-called KPI also. I think that is
Yeah.
holistically,
Alright.
these are
Do
real
you,
achievements.
because you are also inventing these particular apps, do you have like copyright or patent for it?
Yeah, we have handful of patents. Now we are discussing and negotiating with commercial companies on how to bring this forward to the commercial space. In other words, how this IP, intellectual property, or patents can be monetized through commercializations, product development, and so on.
But you have your commercialization on the products already, right? Do you have it in the
Still
market?
in the process.
Okay, in the process.
Because we need a commercial company to really run
To invest on that particular product.
also, yeah. Quite a big gap between R&D and commercialization. Usually it's 5 to 10 million kind of funding gap. Usually it's not funded by a lot of agencies.
Correct. Seems that you are the expert in this digital health. What do you think, what is the future for this particular area, this study?
Because of prevalence of technologies, digital health, for sure, it will be part of our life. What we have observed recently, these 3 to 5 months, is that less and less people willing to go to clinics, willing to go to hospital. Okay, which means they still want to receive healthcare services at home, normal clinic or hospital. So this digital health can bring the healthcare services from clinics and hospital to the consumers at home. So digital health will be always on demand. So, and not only that, but also growing all over the world.
Correct. So it's not only in Malaysia, but it's also happening all over the world.
Yes.
Yeah, with this COVID pandemic 19, I'm sure that the apps will be more famous right now. That everybody is assessing it and wanted to purchase it on the market.
Yeah.
So we're waiting for yours that you will commercialize it later on. Okay, so that one is the future, but we can see the bright future of this particular apps because everybody is using it right now, and even the small generation and the latest generation also trying to we call that, to use this application. So as what you mentioned just now, the what we call that, the highest achievement of your research is the team collaboration and the team effort from everyone in your group, right?
Yeah.
So I believe that you have many of these. How many of your RAs and also your students that actually involved in the project?
5 to 10, depending on the
You
projects.
also work together, cluster with other universities?
Yeah, with other universities, locally and internationally.
All right.
Yeah.
So you have, I would say, many papers coming up from that particular research. Yeah?
Papers, yeah. Yes,
that's why you've been, what we call that, been granted with the best paper in your conferences and also in the summit. They also call you for giving a talk, right?
Yes, as a keynote speaker, something like that.
Okay.
Sometimes it's a tough decision between patent and publication.
Yeah.
If it is published, it cannot be patent. So
exactly.
we have to choose one.
Okay, we have to stop for a short commercial break. We'll come back after this. Kita kembali lagi di dalam rancangan R&D. Prof Patrick, we're talking about just now is your highest achievement in that particular digital health area. and also we're talking about some of your copyright and your patent. Probably you have some, in the pipeline, the best research, the best proposed research that you wanted to do, or the commercialization that you wanted to do after this?
Yeah, I would like to take this opportunity to invite future investors or any commercial companies to reach out to my team, where we have a research portfolio of quite a number of digital health R&D products and outputs. One of it is remote monitoring of body temperature, and also ECG, which is heart condition and respiratory rates. This is very relevant to COVID era, because doctors also don't want to get near to patient too frequently. Yeah,
Correct.
this first one. Second one is the blood pressure monitor that is wireless, where you can share your BP, blood pressure, with your doctor directly without sending WhatsApp or SMS.
Wow.
So your doctor can monitor
Exactly.
almost real time, 1 or 2 seconds slower than that only. And we also have like the food apps that I mentioned just now to manage chronic disease. This we would like to bring it to the market, but we, as a university, we cannot do it ourselves. We need to work together with commercial companies.
All right. So this is all the new apps that is not in the market yet, right?
Not yet.
Okay. So that's why we need a lot of these industries or the companies that are willing to invest. Yeah. So maybe you can conclude a little bit on this particular digital health in the future for those researchers that wanted to embark into this particular area. What is your advice or suggestion for them?
Yeah, and for younger generation, I will always remind them when they go to career, when they go to business, right? What kind of business, what kind of career they should embark into. Most importantly is to ensure that they are going to be a producer.
Correct.
Producer, in our case, is we produce some product and services and commercialize it or sell it to locally or internationally. This is where we can increase our GDP, our foreign investment into the country, into the states.
Exactly.
So digital health has no geographical boundary. So if we have the apps, if we have the artificial intelligence model that we develop here, right? There's nothing to stop us from selling this overseas, around the world. Right. So this is my advice to all of them, to really think about this. If it is not digital health, what else can they achieve? Can they do to achieve as a producer to the world?
I see. So from them invest to right after to the business area. Yeah. So we would like to conclude this particular topic today that Prof Patrick have shared with us today, whereby the digital health is a very important nowadays to the young generation and also to the elder generation. Yeah, because we will have to develop, we have to do R&D, the copyright, and also up to the patent, and we will commercial it on that particular apps. So as what Prof Patrick have shared with us today, it is tremendously very important and very useful to all of us as a generation that throughout this pandemic COVID-19. Okay, so I would like to thank Prof Patrick for your time, and I'm sure that we probably will meet again in the next episode. Yeah.
Thank you very much.
So sekian sahaja program Bual R&D kita pada hari ini untuk TVS. Kita akan berjumpa lagi di episod yang akan datang. Saya Qistina Donna Lee Abdullah mengucapkan Assalamualaikum dan salam hormat.